Hi, we'll start again. Hi, my name's Omar Benyed. I'm the group publisher at African Business Magazine. I'm here today to support the African Risk Capacity with their event on health and preparedness and adaptation. So I've known the Africa Risk Capacity for a few years, but I knew them as key players in the agricultural space, helping the most vulnerable in times of droughts, floods, and tropical cyclones. So it was interesting when I spoke to the African Risk Capacity team, who told me that actually they wanted to extend their remit to now cover health outbreaks and pandemics. And really my idea was, or my question to them was, why are you going into something that's completely different to what you've been doing since 2012? And the answer that I got is actually our remit is to help the most vulnerable in times of distress, you could say. And what we've seen is we've seen the vulnerability of a globalized world to fast-moving disease. And we've seen it with SARS, we've seen it with Ebola, and we've seen it in the past year and a half. So actually, when the African Risk Capacity mentioned that they wanted to get into health outbreaks and pandemics, it made absolute sense to me. And obviously, prioritizing public health is as important to economic resilience as anything, and we've seen this past year. So it's my delight to welcome Ibrahima Sheikh Diong, who's Under Secretary General at the United Nations and a Director General at the Africa Risk Capacity, who'll make some general remarks, welcome remarks, and talk to you about what African Risk Capacity is doing and the nexus ultimately between helping vulnerable people and making sure that we've got the right preparedness when it comes to health. Thank you, Ibrahima.
All right, can you hear me? Excellent. Good afternoon to all of you. You can just wave if you can say good afternoon. All right, so we're connected now. Let me extend a warm welcome not only to you, to those who are watching and listening online from around the world, to this extremely important event at COP26. Let me begin by thanking WHO for welcoming us. And I like the slogan they have in the background there, Climate for Action and Action for Health, which is quite timely because it's important to mention. Even though we all come here for climate change, it's also important that outbreak and epidemic affects many people across Africa. So the opportunity to link the two, it's a great opportunity for our organization. It shows once again our commitment to supporting vulnerable communities across Africa, and that's why this event is extremely important. The organization that I have the pleasure of leading at the group level, it's a mandate given to us by the African Union with the sole purpose of helping African countries to prepare themselves, to plan properly and respond to disasters, what is climate change, but also outbreak and epidemic. And that's why for us, the link between climate change, outbreak and epidemic, it's a natural link because it has one purpose, is to protect Africans across the continent. The conversation we're about to have is also very much in line with our belief as an organization. The only way we can address the impact of climate change and outbreak and epidemic is through smart and strategic partnership. That is why I'm delighted. We have GCA on board here today with us, with whom we have an MOU. We have also other partners, UNDP, with whom we have signed an MOU. And we are in advanced discussion with WHO and WAHO. So therefore, we're among partners here today to make sure that we can demonstrate together, we can join forces and making sure we can protect Africa. For us at ARC, we believe in the importance of early warning because by having that information, government can make the sound decision so they can actually decide if to return the risk or transfer the risk if they choose to do so. But for ARC also, we believe in building the capacities of African countries to make sure they can respond to disasters as appropriately, be it climate change, but also outbreak and epidemic. So I can assure you the commitment of our organization, whatever comes out of here, as recommendation and ideas to go back to our countries and make sure those recommendations are not left unattended for, so that we can improve what we do for Africa. So I am looking forward to the conversation. I'm looking forward to your great ideas. I'm looking forward to the innovation that we expect from all of you, so that together we can make Africa more resilient, beat climate change, beat outbreak and epidemic. And as WHO said, climate health for action, or health for climate health, climate change. So we are in the right place to have this conversation, and I look forward to the next step. So on that note, Omar, over to you, and thank you very much, and I look forward to the conversation. Thank you.
Okay, thank you. Thank you, Ibrahima. And ultimately, undoubtedly, climate change will lead to more outbreaks, which means that we definitely need to build a resilience in terms of our health preparedness. I'd like to call upon Dr. Amadou Ba, who's the Senior Public Health and Country Liaison Officer at the Africa Risk Capacity. He's been there for about 5 years, and prior to that, he was actually in Geneva at the World Health Organization. So he understands the nexus both between climate change, health, and helping the most vulnerable. So Dr. Ba, for a short presentation, thank you.
Thank you very much. Can you hear me? Excellent. So good afternoon to everyone. My name is Amadou Ba. I'm the Senior Public Health and Country Liaison Officer at the African Risk Capacity. So in few slides, I will try to provide an attempt to provide just a quick summary of what we are doing in the Outbreaks and Epidemics program, and the need to invest in early preparedness and response to address the problem of disease outbreaks in the African region. Next slide, please. Okay, so the first slide is related to a recent study from the World Health Organization showing in the past decade what was the trend in terms of frequency and severity of disease outbreaks in the African region. So we can see from that publication that the top row in the figure is the year 2016, and the second and third row is 2017, 2018. So we can see for different African countries, as compared to 2016, which is a benchmark in that study, we can clearly see that there is an increase of disease outbreaks, but also a quite significant increase in terms of severity of the outbreaks by the bubble represented here. Next slide, please. So here as well, another example from the World Health Organization, using the joint external evaluation, which is a gold standard method to assess how well a country is prepared to prevent, detect, and quickly respond to public health emergencies. So we can see from that figure, countries in red in the African region are countries where there is quite significant work in order to better prepare those countries to address the issue of disease outbreaks. And the one in yellow are the one which have made progress, but still very significant work needed in order to better detect, prevent, and respond to disease outbreaks. Next slide, please. Okay, in terms of financing options for disease outbreaks, so we can clearly see when we have from the declaration of an outbreak to an end, so there are different financing mechanisms in place available either to countries or available to agencies. So for example, for agencies, for example, we have the WHO Contingency Fund for Emergency, which is released quite early, immediately, let's say, at the beginning of an outbreak. And in terms of mechanisms for countries, we have the Catastrophe Containment and Relief Trust Fund, for example, but which is coming at a later stage during the evolution of an outbreak or an epidemic. So here we can see that there is a gap for countries to respond early to disease outbreaks. And this is where the African risk capacity would like to position itself to provide early funding to governments in order for them to act quickly and manage further transmission of a disease. Next one, please. Okay, so here we can see where ARC would like to position itself, providing early financing mechanisms directly channeled to countries. Next one. Okay, so just to recap briefly on the Outbreaks and Epidemics program from the African Risk Capacity Group. So we have piloted this project in 2 countries, Guinea-Conakry and Uganda, and we have selected disease of epidemic potential in the first phase. So these are mainly hemorrhagic fever disease, Ebola, Marburg, and Lassa fever. And also we have included from consultation with countries, Africa CDC, and other partners, the meningitis outbreaks. So in terms of work streams, we have developed risk management tools to better equip countries to better respond to disease outbreaks. So the first one is the risk profiling, where we are assessing the level of preparedness of countries. The second component is the contingency planning. This will allow countries to effectively respond to disease outbreaks. And the last one is the modeling. So here in that work stream, it is to anticipate and to estimate the level of risk that countries are facing. And all of this work will lead to the design of a financing risk transfer product, which will allow countries to quickly use the funds in order to enable early response to a corresponding outbreak. Next one. Okay, just to conclude, so in order to address the issue of outbreaks, epidemics, or pandemics, it is twofold. We need adequate structures which are responsive and linked with contingency planning, and also adequate funding. So within the African Risk Capacity Outbreaks and Epidemics Program, so we are aiming to provide to the continent a sovereign risk transfer product in order to mitigate the financial losses. And also this product will improve the preparedness and the response capacities of countries. And finally, we are aiming at, once the product will be ready and for launch, we are aiming at providing coverage to around 50 to 40 million people, and in terms of coverage, sorry, and protect around 200 to 700 million people in few countries over the next years. Thank you for your attention, and looking forward to that session. Thank you.
Hello. Yes, excellent. Thank you very much, Dr. Ba. I think you're going to be joining us on stage as well, actually. So, look, I was reading the report by the WHO, and they said that preparedness costs about $5 per person per year, and the cost of COVID they estimated at $11 trillion to date, and a further $10 trillion in lost earnings. That's $20 trillion. That's a quarter of global GDP in a year. That's incredible. So, but ultimately, I think one of the messages in my previous conversations with you, Dr. Ba, was all about building that culture. And it's very easy to react to something, but it's a lot harder to anticipate, prepare, and have that right culture and mentality. And I'd like to pick up on one point that you said. It's about partnerships, and I know we've got a partner here with us, and we've got some partners online. But again, from the WHO report said you don't hand out your business card during a crisis or an outbreak. You hand it out in times of peace to prepare, plan, so that when something does come, so when there is an outbreak, we're prepared and we can act at speed all together. So I'd like to welcome one of our partners here from the Global Centers for Adaptation. If you can join us on stage, Eddie Jorge Vasquez, who's a senior advisor Africa at the Global Center on Adaptation. But if you don't mind, Eddie, I'm going to call upon one of our virtual speakers, Dr. Kutsia Houdet, who heads the Disaster Risk Management and Resilience at the WHO, who's going to join us online. And Houdet, I actually would like to ask you one question, because ultimately, in terms of vulnerability and the globalization of diseases, let's say, diseases are fast moving today. I had a question to you in terms of Africa's preparedness compared to the rest of the world, especially related to this particular pandemic, because of what we suffered back in, I think it was 2014 to 2015 in West Africa, in Guinea, in Sierra Leone, in Liberia. So would you say that there were lessons from Ebola in West Africa in terms of our preparedness and how we responded to this particular outbreak? Or do you think the lessons were learned, but there's still a lot to do? Houdet? Dr. Houdet?
Okay, so good afternoon, everyone. Thank you very much for the question, Amor. So I think that this question is quite pertinent to ask today, and then I think that it should have been asked quite earlier to the whole world, not only Africa. So I know that you are asking this question to me to reflect on Africa, but I would like to answer it, to take it from the global level, because it's important to do so. As my previous speaker and also Ibrahim has said it quite nicely, that we all need to work together in this, and we all need to come together. So this is where I would like to pick up my answers to your question, because this question is of paramount importance to us in the future, because so far, pandemic preparedness has received very insufficient political priority globally and has largely been confined to the health sector, while the impact of COVID-19 is quite widespread, particularly affecting socioeconomic sectors worldwide. So this very sentence would differ from the preparedness for a pandemic and preparedness for Ebola viral disease, which is within a country or within few countries, but not pandemic. So that's the reason I say that I will allude my answers to the pandemic so that we can get to the point that what are the countries need to do and what's happening at the national and subnational level. So I would like to highlight a couple of issues here. One, the extent of pandemic use has not been appreciated in financial decision-making or whole of government or organizational priority setting at all levels, be it subnational, national, regional, or global. Then multi-sectoral coordination for pandemic risk management has been visibly lacking. So for example, while the Sendai framework for disaster risk reduction includes pandemic risk in its purview, the risk management capacities have largely been separated from health sector actions for COVID-19 preparedness and response. Again, this is the global scenario. Let's see what the evidences are out there to shape our actions for better preparedness. I think this is the time we should discuss what would be better, taking the lessons learned from what happened before. Several reviews of the global response to the pandemic spotlights on some critical areas, of which I would like to allude to four. Firstly, we need better governance at all levels, a governance that is guided by risk. As we call it, risk-informed governance. The existing global health security architecture is very complex and fragmented, and voluntary mechanisms have failed to create the level of commitment and actions needed to consolidate our approach. As our DG says, there is a need for solidarity and an international instrument of consensus to ensure an operational global cooperation. Why I'm saying that? Because when you particularly focus into any region or some countries, it's important to bring that solidarity, because neither the health sector alone nor a country alone can manage the risk the country's communities are exposed to. My second point, I think that Dr. Ba has already mentioned about the very nicely, giving a lot of evidences. And so I wouldn't go there. I would just highlight some strategic things here. We need better and sustainable financing for pandemic preparedness. Though I'm saying it's for pandemic preparedness, but this is not only pandemic, because pandemic doesn't come to a clean community or clean world. It comes accompanying with many other risks countries and communities are potentially exposed to. So sustainable financing for pandemic preparedness or any public health emergencies means substantially increasing domestic investments and international financing to support low and middle income countries, which means building upon existing financing initiatives and consolidating the global health financing architecture. The third point, we need better health system and tools, which not only reacts, but also withstand risk through gaining intelligence across the sectors. Our health system needs to be resilient and equipped enough to be able to detect, prevent, respond to risk from all hazards. We need to build synergies, connection to other sectors, particularly animal health, for risk-informed preparedness. We need to integrate approaches to improve health system resilience based on a primary healthcare approach with a right-based risk-informed manner. Resilient health system is key for universal health coverage and health security. We need to leverage also all innovative technologies to do so. My last point would be everything we do needs to be grounded in communities. They are the first aid, they are the first responders, so we need to do everything in our power to capacitate community. They're the key to a robust pandemic preparedness, not to mention any other public health emergency preparedness. Their actions led the ways in harnessing the local knowledge to scale strong pandemic preparedness. We need to listen to them. They know what's best for them. We need to design all strategies, policies, plans, everything with the communities and not just for the communities. Well, the opportunity is knocking at the door that post-COVID-19 recovery is opening for the world. We need to use every learning from this current pandemic and other public health emergencies to design a sustainable and green recovery together with communities, making sure that no one is left behind. And this needs strong to achieve in all sectors to ensure effective community engagement with an enhanced focus on equity. We must use all hazard risk management approach to prepare the world. We have seen this in the current COVID-19 pandemic, and also we have seen this in the Ebola outbreak in the Africa region, that how concurrent emergencies and disasters like cyclones, storms, floods, protracted crises, population movement, impede our response to any public health emergencies, not to mention this current pandemic. They jeopardized our efforts and overwhelmed our health system. So preparing for any public health emergency is preparing for multiple risks countries and communities are exposed to. Here, I see that AS is doing a great job in bringing that risk discussion on the table, which I think is a gap in whole preparedness action that we do. The world has progressed since the Spanish flu pandemic, some 100 years back. We need to use all those progress development to build a new world where our children will not be afraid of having another pandemic and lose their school years, lose their childhood, lose the moments to be careful. To be honest, Omar, I'm waiting for the time when you will not ask what we can do, but we must do to prepare the world for any public health emergencies, any adversity such as this pandemic. Our resources are limited, but as a human race, we have unlimited potentials. We must build a better future. We just don't have any choice anymore. There should not be any excuse not to do what we must do. The reason I'm raising all these issues, now we can look back and we can see that what we have done better, we build on that. I think this is what I need to say for African region, and then also what they have done better. Till we speak today, 9 countries in Africa only this year developed their risk profiling. And I see that risk profiling is your first part for your risk management approach. I'm very helpful, taking the lessons learned, building on that, things will happen, and we can prepare the health systems in Africa region. We can make them resilient, not only the health system, but whole of society in support of the health system. Thank you.
There, thank you. So, I mean, you raised a lot of points and there's a lot to unpack. We haven't got the time to go through all of them, but I mean, there's one thing that stood out from my perspective is there's a clear financial risk, and government isn't always the best person to assess that risk. nor to take the measures to measure the risk and to deal with the risk. And the second point that I think I took home is ultimately when there is an outbreak, we need to act quickly. And it's important to respond very, very quickly and to have everything in hand to be able to respond, which is, I think, what the Africa Risk Capacity is trying to do. We're going to go to, before we go to Ede, we're going to go to Stan, if you don't mind. So Mr. Stan Quain, who's a director at the Regional Services Center for Africa at the UNDP. I mean, we mentioned a little bit governance just now and capacity building at government to be able to, as we said, risk manage and risk assess. So maybe you can tell us a little bit about at the UNDP, what are you doing in terms of strengthening governance and local governance around disaster risk management? Stan.
Thank you very much. And I'll build a little bit on what the previous speaker, as I said, pandemic response, preparedness is probably only as good as preparedness in other areas or in other sectors. And I think the work that we do as UNDP takes that into account in strengthening capacities for disaster risk management and preparedness. And I'll share with you a number of examples which I hope can be useful to highlight that we do recognize, in fact, the ever-increasing complexity and scale of risks of the continent. And we have a whole resilience hub out there in Nairobi that is helping us pull all of that together. We are indeed one of the leading UN agencies on disaster recovery, and we offer expertise and resources in building national and local recovery planning and coordination capacities for risk-informed development. And we support governments and local authorities to develop institutional and governance structures, policy tools, and including strategies and legal frameworks. And some of the policy tools we are working to support on the continent, I'll take a couple of country examples. In Cote d'Ivoire, for example, we are supporting the PM's office in conducting a post-COVID-19 review of the crisis management system as a whole. And we are providing assistance to the development of a national crisis management plan. Without that kind of policy framework at national level, things get more difficult to manage. In Niger as well, we've been active in disaster recovery planning with the development of the National Sustainable Recovery Strategy, building national capacity with the post-disaster needs assessment methodology that brings together the bank, the UN, and the EU with the establishment of a recovery funding mechanism. And in Senegal, UNDP is helping the government develop its very first national disaster risk reduction strategy. We are not limiting, we don't limit our work, of course, to the country level. We are also supporting ECOWAS in West Africa in developing a regional resilience strategy for West Africa that aims to provide policy guidance to member states in building resilience to shocks, including pandemics, of course. Continuing on these policies and strategies, we also work with our partners to build operational capacities for disaster and crisis preparedness and response. Depending on the country's needs, these policy tools can vary and include setting up national or local emergency operations or crisis management centers, helping design emergency early warning and risk information management systems, facilitating preparedness and contingency planning exercises, and developing standard operating procedures for disaster or crisis response, and advocating and enabling the integration of gender and diversity markers into preparedness and risk management instruments. And a couple of country examples in these areas as well, in Liberia and Sierra Leone. In Liberia, for example, we are supporting the establishment of the National Emergency Operations Center, which has so far significantly enhanced the capacities of the National Disaster Management Authority, and another vital national policy tool in coordinating major emergency and disaster responses. In Sierra Leone, we are supporting the Environmental Protection Agency and the Sierra Leone Meteorological Agency with equipment for establishing functional networks of coastal climate and sea level rise monitoring systems. And at regional level in this respect, we also have been supporting the African Union Commission in developing a continental framework for multi-hazard early warning and early action, bringing together systems and processes and actors engaged in monitoring natural hazards. And this may also lead at some point to the establishment of situation rooms at the continental and regional levels. Another policy tool, which is also a challenge, has to do with data and the establishment of data platforms. We know that all disasters, including those triggered by biological hazards, such as COVID-19, do impact people differently. And when it comes to decision-making for pre-disaster preparedness, early warning and early action, sometimes the data that are needed are often hard to obtain. So we're therefore working to support national and local authorities in data collection on risks and disasters, risk analysis and mapping using GIS tools, and monitoring and evaluation and disaster registers and disaster management tools. And some examples in this area of data include our partnership with ECOWAS at regional level to support countries in Western Sahel and the Lake Chad Basin, 7 countries in all, Burkina Faso, Chad, Mali, Mauritania, Niger, Nigeria, and Senegal, to strengthen national disaster loss and damage databases, disaggregated by sex, age, disability, and many other subcategories. And at sub-regional level, in the Lake Chad Basin Commission, for example, working with the Lake Chad Basin Commission and our partners at the African Development Bank to support adoption of a multi-risk approach, critical to inform the implementation of the regional stabilization strategy. In Niger, for example, a policy tool in this area, we are partnering with the government of Niger to equip and train staff of their vulnerability monitoring observatories. These are important policy tools at national level, as well as early warning and emergency response systems established in various municipalities. We also find that communication and advocacy are critical policy tools to inform the general public on risks to safety and health and disaster preparedness, and on the right behavior to adopt when the disaster occurs. And we have examples of this in Kenya, where we are strengthening the capacities of the National Disaster Operations Center and the National Drought Management Authority to improve virtual communications. We're working with local authorities on the development of country hazard profiles. We're also active in the field of public sensitization in various countries of the continent. An example in this area is Burkina Faso, where we trained some 15,000 volunteers as communication agents on COVID-19, as well as journalists and influencers in order to better communicate and inform the population on COVID-19 prevention. There are a couple of other examples, but I think I'll just probably end with a few challenges that we have in this area. Several challenges that we face, as you can imagine, but I'll just probably cite 3 in the areas of technical capacity, financial support, and the political space. Technical level, to start with, there are often capacity shortfalls to lead and effectively manage many of these structures at national level that I just referred to manage risk, early warning, and early action platforms. It's a lot easier. This is a lot easier as a challenge to handle through the capacity development work that UNDP, that we are doing with many of our donor and technical partners. One of the biggest and most specific challenges in the technical area, as I mentioned earlier on, has to do with the scarcity of data, critical for defining the problem, assessing and managing risk, and establishing baselines for change. A second challenge, of course, is funding. A lot has been said about funding. Just on a general level, the tendency of funding partners to focus almost exclusively on response rather than anticipation, risk management, prevention, and capacity building outside of disaster events and their visible impacts. So here, a broader funding perspective would be most helpful if we want to make a difference in risk management and climate change adaptation for better health outcomes. A third challenge is political in nature and has to do with sometimes the inadequate or not sustained national buy-in and ownership and leadership, often difficult to come by after the immediate response phase of a crisis subsides and attention starts to fade, and then governments in general tend to resort to default business as usual approaches. With COVID-19 is a little bit different in that this has gone on for much longer than I think was anticipated, But the tendency is still there for governments to have a very short attention span and to resort to business as usual. Third, final challenge, I think coordination. And I think that this is where we actually feel that the regional and sub-regional institutions that we have, such as the African Risk Capacity Agency, have a vital role to play at regional level in terms of the credibility they bring to help countries adhere to some of the regional instruments that have been put in place. And the institutions like this can play a vital role in continuous advocacy. And thus, our regional work in this area also is very critical. So let me end there. We put all of this work within the broader framework of risk-informed development, which of course includes a lot of what we do also in support of COVID-19 recovery and other areas. Thank you very much.
Excellent. Thank you very much. Thank you very much, Stan. I mean, again, you've said too much to unpack in a few seconds. But basically, if you can't measure it, you can't manage it. That's for sure. And I used to think as a young child 15, 20 years ago that I was living during the best history of humanity. 15, 20 years later, I'm not so sure anymore. But Ede, sorry, if we can come to you. I mean, we've heard a lot ultimately in terms of what needs to be done, and what we do know, I think, is there's going to be an increase in outbreaks, and importantly, in the severity of outbreaks going forward. So you've just released a report on adaptation and on Africa. So what are the key take homes, and what are your thoughts in terms of what we should be doing as well?
Thank you, Omar, and thank you so much for the African Risk Capacity for the invitation. I think that the last message of partnership becomes critical into this process. We just released the most comprehensive report on the state and trends of adaptation in Africa. And on the health side, there are three important messages. First, given the tremendous challenges of the health systems in Africa, the most important measure is really to strengthen them. Only 45% of the population has access to strong health opportunities, and therefore a population that doesn't have a strong health, any shock really throws them. And 15 million people in Africa every year are thrown back into poverty because of expenses related to health altogether. Second, the trends are slowly changing, but they're going to get far more serious. As Africa's health indicators begin to improve, then the importance of the health impacts of climate change become more and more critical. So as malaria expands their areas, as the undernutrition caused by crop failures increase, as you have more vulnerability on floods in low-income communities, then those factors become more and more important. And the solution is not always in the health sector. For example, in inner Kampala, when you have a 1 in a 10-year-old flood, which happens actually quite frequently, the people generally have, under dry conditions, everybody can access a health facility in 15 minutes. With that flood, actually a third of the population cannot be accessed and picked up by an ambulance and go back to a health facility within 60 minutes. And that's the golden hour into this process. So the solutions to the health challenges in climate are also in many other sectors. Finally, to conclude and to connect to the conversation today on outbreaks, there are important tools that may need to be looked at in a combined way. The report looks a lot about adapted social protection systems, how to help individuals and households, particularly those are the poorest and most excluded, to deal with this crisis and these shocks in a way that doesn't throw back either into poverty or that don't throw the children into health impacts for the long term. Remember that 40% of the stunted children in the world, those who have been stunted, are in Africa. Therefore, health impacts like either a pandemic or a climate shock need to have adaptive social protection system that allows. Second, early warning systems. Many of the other speakers have talked, and it's easier said than done because it's not only to be able to have the system for understanding the warning, is to give the information to everybody in the population, and it's for every individual and household to know what to do with that information, how to protect themselves, how to move into this process. And then finally, as Africa strengthens its health systems, that strengthening needs to account the shocks that they're going to have due to climate change, where to locate them, how to get ready for crisis, how to make sure that that planning takes place. And Africa Risk Capacity is really building a lot of the systems and helping African countries build that capacity of early warning systems. That tends to happen with the Disaster Risk Management Agency. That integration into health systems is fundamental. Thank you so much, Omar.
Thank you, Rick. That was fantastic. Thank you very much. And so, again, some worrying statistics ultimately. I mean, 50 million people going back into poverty because of outbreaks is tragic. So we'd like to call upon Dr. Virgil Lokusu, who's joining us again virtually. He's a team lead for health emergencies and disaster management for WAHO, the West African Health Organization. So he oversees the ECOWAS region, so the economic community of West African states. So Dr. Virgil, I'd like to ask you really, I mean, Dr. Barr earlier mentioned that there are various mechanisms in place to finance outbreak and outbreak responses. But I mean, from talks that I've had, not all mechanisms are predictable and can be slow. But I wanted to know at the ECOWAS region and within WAHO, are there any current mechanisms in place to finance outbreak responses? And if so, how do they work?
Yes, thank you very much for the questions, Omar. First of all, let me start by thanking the organizer of this conference, and especially WHO and Africa Risk Capacity, for inviting WAHO on this important panel to discuss how to strengthen health outcomes through risk management and adaptations. With regard to your concerns about the mechanism in place to support the funding of outbreak response, I have to recognize that we have several mechanisms in place. First of all, most of the member states in the region try to establish a domestic budget line to support outbreak response. But the problem we are having is that most of the time, countries are facing a lot of challenges. So it's difficult when facing the scarcity of resources we are having in this region to save some resources in case the outbreak will come, because we already face a lot of emergency situations in West Africa. That's number one. So the amount the country are able to save is not substantial to address the needs of the immediate response during the outbreak time. The other big challenge the countries are facing, the regions also, is about the administrative procedures to access these fundings. It's also really a challenge, especially in the early stages of the response. And many countries experience a huge delay at the critical time of the response. I remember I was deployed in Guinea in 2014, 2015, and it took almost 11 or 12 months for the country to mobilize domestic resources to address the situation, when international funding were already deployed in the country. So that's always the case in many countries when dealing with outbreaks. We also have some multilateral mechanisms, especially coming from WHO contingency funding, is very useful for countries as well. We also have World Bank, with the country having to have a contingent emergency response funding as well, where countries can mobilize immediate resources to address the needs in case of an important public health event. We also have a mechanism in place with with bilateral cooperations, I should say. We have US government, French government, and German cooperation also providing direct support to member states through bilateral mechanisms as well in the regions. And ECOWAS, as a regional health organizations, also are providing a direct response based on requests from member states coming from the regional solidarity funds. But all that put together is not enough when you look at the number of the public health events the West Africa is reporting, and even disaster we are having in this region actually. So there is really a need to innovate, to reinvent the way the system is right now to be more efficient. And also, there is also, that's the reason why, actually, we are collaborating with Africa Risk Capacity in the new products they are developing to support the countries. I'm talking about the insurance systems, especially with priority diseases in the system based on our own risk profile. So we are really optimistic that these systems will bring a new era of outbreak response in our regions. So we also have partners like Africa CDC, Africa Union, and other non-governmental organizations also coming to support outbreak response. But it's really coming time to time on the ground. But in general, what I want to come out with from this talk is that there is a lot of fragmentations where we are lacking resources to deal with health emergencies. That's my takeaway from this picture. Thank you.
Thank you very much, Dr. Virgil. So, Dr. Ba, we'll come back to you if you don't mind. So I know that you work very closely with these different organizations, and obviously we need to work in a cohesive manner, as Dr. Virgil just said. But moving forward, what are the key milestones for ARC in relation to its outbreaks and its epidemics program, which I think you're helping to coordinate?
Yeah, thank you very much, Omar. So as mentioned earlier, the aim of this product is really to address situations of epidemics which are of high severity, but not so frequent. So this is the reason why we have selected in the first phase those four disease of epidemic potential. So for now, what we have done so far, we have developed the different risk profiling, the different risk management tools in order to support the design of the product. So the product itself, there are few steps which are required in order to have it fully functional and available to our member states. So we need to work closely with structuring agents in order to design how best the product could be. We need also to model the risk. So as mentioned, the work was done in 2 pilot countries to date, but we want to expand our offering to the African Union level. So we need to conduct some risk modeling work, and this will be done with the support of a modeling agent, which will be on board very soon. And this will allow us to estimate the risk of epidemics in those different countries. And I think the last point as well is really to define the contractual agreement between ARC and the various member states in order for them to be enrolled in this program and to benefit from this product. So these are the next steps which are in the pipeline in order for the African risk capacity to offer this risk transfer product to African Union member states. Thank you.
Thank you very much. I was checking my phone just to see if there are any questions from the live stream. There's just comments, I'm told. So Eddie, maybe we'll go back to you. So Dr. Ba mentioned it earlier on, but about creating the right culture around disaster risk management. So how do we create this? So how do we establish this culture of disaster risk management to make sure that we have those early warning systems, those prevention and the right response mechanisms?
Absolutely. I think that there are 3 elements that are important in that process of transformation. One is to have enough of the infrastructure for those early warning systems to work, meaning the data collection, the ability to project and predict what may be happening in the future, and then the mechanism to have that information in the hands of everybody that needs to have it. Now that requires first an infrastructure of data collection. There's much to be done. Unfortunately, in Africa over the last 5 years, for example, surface-based weather observations have gone down by 50%. WMO is now working really hard to make sure that that problem gets solved. So you do need the data. Second, you need to be able to have enough of the transformation of that data into information that is usable, so that a farmer gets a text and knows what are the implications in terms of crop that they need to select and the farming that they need to do in that process, so that the cities and the mayors know what is it that is going to be the risk that they have. So the Ministry of Transport, for example, has prior contracts to repair certain roads that they know are going to be happening to this process. And then the final is a behavioral change. And that's not unique to Africa, that's everywhere around the world, to be able to be prepared so that every households know and think through, look, what are the risks that are going to happen? If this happens to us, what do we do? Our house is in a high flood area, and therefore, how do we know that we move the furniture from the first floor to the second floor to be able to save our assets? Or there's going to be a major storm, what are the documents that we need to take? That kind of preparedness is a change of behaviors that, I repeat, is not particular to Africa, it is globally that needs to happen. And so infrastructure, from infrastructure to do information, from information to change of behaviors. Thank you.
Perfect. I don't know if we've still got Dr. Virgil on online. Is Dr. Virgil still there?
Yes, of course.
Excellent. Dr. Virgil, so look, we've got exactly 3 minutes before I need to hand over to the chair. But my question to you ultimately is about the difference between rural areas and cities. I mean, I know that ARC has dealt a lot with farmers, and ultimately these farmers are generally in rural areas. But in terms of health outbreaks, my instinct will say that the bigger risks is in urban areas. So, what's your experience ultimately between the difference on the risk front between the urban centers and the rural areas?
Okay. Thank you so much for the questions. I will be looking at this question at saying that urban areas are facing more risk than rural areas. I think each context has different risk and have different capacity to address those risks. So we need to make this analysis in an holistic manner, taking the context quite differently. Urban cities have more capacity, have people more equipped with more knowledge to change behavior, as by just the previous speaker explained, have more information, more data from the urban area. But where remote areas are hard to reach, and people there have less access to relevant information to protect themselves from the risk. So I will be a bit, I can say, moderate to conclude that one area is facing more risk than to the other.
Excellent. Thank you for your brevity as well, Dr. Virgil. I'd like to thank all my panelists, Dr. Hude from the WHO, Mr. Stan McQuain from UNDP, Dr. Virgil from WAHO, the West African Health Organization, and Eddie George with us from the Global Center on Adaptation. So I'd like to hand back to Mr. Ibrahima Sheikh Diong, who the Assistant Secretary General at the United Nations and the Group Director General at the African Risk Capacity Group.
Well, thank you very much, Mr. Moderator. Can I ask you just to give a big round of applause to our moderator, all of our speakers from different parts of the world. A big thank you from the entire ACT group for honoring us with your presence, but also for your great contributions. And let me start also by thanking WHO. We could not pick a better place to have this conversation with that great logo, but also the great actually slogan about climate action for health and health action for climate. That is really quite timely, but also quite fitting for the conversation which gets hard. There are a couple of takeaways that really speak to us at the African risk capacities. And let me just volunteer some of them, because this is something we'll take back to our headquarters in Johannesburg and make sure we can get inspired and energized at what we do for Africa. I think number one, I was quite impressed by the fact that many of the speakers have underscored the importance of building the culture of disaster risk management. If you wait till it happens, it may be too late. If you wait till it happens, you may actually lose some life. So therefore, I hope all of us get that message loud and clear so we can go back and continue to build the culture. But we at ARC believe that you can't build a culture without evidence. And that's why we have many great stories to tell, whereby we've seen what we do saving lives. So hopefully it will help to build that culture by having that base on real stories where lives have been saved. I think second, we're very much confident by the holistic approach you've all also talked about. And that is to say, for us to be effective in disaster risk management, there are a couple of pillars that are extremely important. Number one, I heard so many people talk about the importance of policy making. It is important that what we do is embedded in the policies of African governments so they can begin to have an ownership about what we do from a policy perspective. Second message is extremely important to us. It's important that what we do is build around a good framework and a good strategy. And in this case, a national strategy of disaster risk management. We at ARC believe that the only way we can actually intervene in a much sustainable way and make sure that countries have a national disaster risk management strategy. So what we do fits with the overall strategy of the country. We heard so much also about the important building capacities, early warning system, preparedness. These are things that speak to us at ARC because it's really at the heart of what we do and make sure that the African countries themselves have the right capacity to deal with their own disaster situation. So therefore, from GCA, from WHO, from WAHU, we look forward to learning from you and make sure we can avail that capacity to our member states so we can continue to build. You also talked about funding. This is something that's extremely important at the African risk capacity. How do we build innovative active funding mechanism so that part of the response, we can have the necessary funding that allows us to actually respond to the needs of African content. That is something that I believe that we can do together as entities. Last but not least, 2 points extremely important. You all talked about the importance of strategic partnership and smart partnership. All the challenges that we talked about cannot be addressed by one institution alone. So I have no doubt we'll join our forces and make sure we can address the different challenges you highlighted. The good news, we already have an MOU with UNDP. We have one also with GCA, and we are working with other entities, WHO and WAHU, to make sure we can build also a partnership. And I have no doubt all of us will go back to our respective countries, inspired, energized by the work to be done, but also by the fact that together we can be successful in making Africa more resilient. And as we do so, let's think about the communities across Africa, the vulnerable communities that we need to protect so we can continue to adapt, make Africa more resilient, but to mitigate the risk and make the connection between climate change and health. So on that note, on behalf of the entire team, on behalf of our great moderator, which I ask to give a round of applause, Mr. Omar, for having done such a great job. And I look forward to seeing you on our lecture series where we can begin to bring all the partners together so we have a great, constructive, action-oriented conversation that we can make Africa more resilient. So thank you very much, wherever you go back, and have a good day. Thank you.